good morning, or good afternoon, depending upon where you're watching us from. Welcome to this wonderful Facebook Live production we have here on blackdoctor.org in partnership with our friends at the National Foundation for Infectious Diseases. I'm going to start with this. If you're like me, and many of you are, when you hear the word flu, you typically go, and especially when you hear the words flu vaccine, you might go, I'm not worried about the flu vaccine. And many of us aren't and haven't been. But the reality is quite different than our perception. And so, what we're going to do today is we're going to tell you about, give you an update on what's going on with the flu, and really help you understand why it's important not only to get your flu vaccination this year, but every year when it's time when the flu vaccines come out. So, a couple things before I introduce our wonderful guest for you today. So, a couple things I need for you to do. First thing I need for you to do is let us know where you're watching from. That's the first thing. Drop it in the comment section. We like to know where people are watching us from all over the world, so drop that in the comment section. Number two, if you know somebody that needs this information, please share this on your page, tag them, like it, share it on your page, tag that friend, let them know, because this is some information that we all need, and we need to share this with as many people as possible. And finally, if you have any questions, please drop those in the comment section. This program is all about you and getting the information that you need so you can make an informed health decision for you and your family. So please drop those questions in the comment section, and we'll get as many as we can asked and answered. So with all those particulars out of the way, let me introduce our fantastic guest for you today. This is Dr. Patricia Whitley-Williams. She is a pediatrician by trade, but she is also the immediate past president of the National Foundation for Infectious Diseases. We're going to have a brief conversation about the flu vaccine and all what's going on about the flu. Welcome to the program, Dr. Whitley-Williams.
Good morning. Thank you so much for having me.
Well, I see some people there are getting in there. We got some people from Maryland and Arlington. So keep dropping your city and state, and if you're in your country, if you're out of the country, in the comment section. So also, before we begin, I have a question for people that are watching right now. We have a kind of a poll, just kind of see where we are. So I'm going to put it on screen here for you. First poll is, do you get the flu vaccine every year? And if you don't, or if you do, or if you don't, but why? Just a brief, description as why you get it or why you don't get the flu vaccine every year. We just kind of want to get a feel for where people are that are watching this program. And hopefully at the end, we've got another poll that hopefully getting this information will help you make, a decision about your health and what you're going to do about this flu vaccine. So make sure you ask that question. So my first question for you, Dr. Whitley, is how has the 2022-2023 flu season differed from previous years?
Thank you for asking me that. We have experienced this year a tremendous increase in the number of cases of influenza, and it came early. As you may remember, during COVID, we really saw very few cases of influenza. The COVID-19 virus was so predominant. However, now that we're post the pandemic, we really are seeing an onslaught of flu cases. Right now, the number of cases are going down a little bit, but boy, in November and December, I have never seen so many flu cases. Influenza came back like a vengeance.
And that is really the one thing that I think people kind of forgot, because we all know for the past couple of years COVID has really sucked all the oxygen out of the room when it comes to infectious diseases. But the flu hasn't gone anywhere. The flu has been with us for over 100 years.
Absolutely.
That earlier pandemic in the early part of the 1900s, and it's actually kind of ironic that 100 years later we have another kind of pandemic that strikes the world. That irony of me.
Absolutely. Flu usually it peaks usually December, January, February, but this year it came early. So it was a little bit unpredictable, but it came and it's still here.
So yes, so and I recently got my flu shot. So and I'm just going to say from
Wonderful.
personal experience, um, full disclosure, that was my first one, right? And I
Good
knew
for
because
you.
I've been hearing about what was going on, and I said, you know what, I might just go ahead and get this flu shot. I got it. Let me tell you something, guys, it's not that bad. I
Mhm.
promise you, and we've all at one point in time probably have gotten a tetanus shot, and you get that dull pain feeling in your arm. This is easy. I was in and out. It was very very quick, and no side effects. Nothing happened at all, and it was fantastic. And I had a peace of mind that came from getting vaccinated.
Mhm.
So
Exactly. I get a flu vaccination every year, and you're right. Really, I don't have any side effects. I just maybe a little sore, but not even
yeah,
that.
no,
So, and it's never too late to get an
is it,
influenza vaccination.
that was my
Even
next
now,
question. Is it too late to get the vaccine?
no, it is not, Elsa. I'm so glad you raised that. It is not too late to get your annual influenza vaccination. In fact, I would strongly recommend that if you have not received this year's flu vaccine, that you make an appointment with your physician, go to a pharmacy where many of our pharmacies now offer flu vaccinations, and get your annual flu vaccination because you want to be protected. Flu is still around, and I know that because I work in the hospital, so I'm still seeing um, children and young adults being admitted with influenza.
Absolutely. So we're here on blackdoctor.org. That's an elephant. That's another elephant in the room. So let's talk about how the flu is impacting communities of color, particularly Black communities, and what are some of the disparities that we're seeing amongst Black people in the Black community getting the flu?
There definitely is a disparity when it comes to our Black community. We have up to 3 times the rates of hospitalizations related to flu illness, um, because our adult community does have a disparate increase in the number of comorbid conditions. And what do I mean by that? Heart disease, lung disease, diabetes, um, whether you're a chronic smoker, all of these comorbid conditions, we call them, make you more at risk. Obesity. And so, therefore, it is even more important that we in the Black community go and receive our flu vaccinations. We are at greater risk of being hospitalized, and we are at greater risk of also dying from the flu compared to our white counterparts. So I think that's an important message for people to hear. We lose anywhere from 12 up to 40,000 people every year in this country from flu related illnesses.
And I think that that's a kind of a big um, misunderstanding. People think the flu, they're equating it kind of more to the common cold, and it really is deadly. And so when that number of people, and you think about not only the people that are actually dying from the flu, but the families that are being affected by that person dying from an illness that can be prevented, or those symptoms can be mitigated by just getting vaccinated. And so we really have the opportunity to really lower that death toll number if we can get more people this information about getting vaccinated, which is why we're here.
Absolutely. It's really knowing the facts, and trying to understand the importance about this immunization. And after all, it's about family first, right?
Absolutely.
So if you want to be around for your family and your loved ones, and you want to protect your loved ones and your close family, it is important as an individual to go and get your flu vaccination, because it's kind of like flying on an airplane, and they say, if the oxygen mask come down, make sure you put yours on first, and then you're
Yep.
able to help others around you, particularly if you have younger people with you. So that is so important. I think of that analogy: take care of
Yeah.
yourself first. So you're going to be around for the people that you love. And then you protect the people around you, because then hopefully that will prevent you maybe from getting the flu. And therefore, you will not pass it on to your loved ones. So I think that's an important message too. Think about it that way.
I like that. I like that analogy. Put your mask on first, then help others. So that's really take care of yourself, and then you can take care of your family and just start expanding that out. But you've got to take care of yourself first. So this is kind of a tough question, but it's one that we need to ask so we can try to get to some answers. Why don't people, especially people in the Black community, take flu seriously or trust the flu vaccines?
I believe that we've done a survey by the National Foundation for Infectious Diseases, and there is research that shows that one of the main reasons why people, particularly in the Black community, do not get their flu vaccination because they are afraid of the side effects, and also they think that it gives them the flu. We know that that's not true. And I really want to get that message. If you're listening, if you hear my voice now, please hear this. There are millions and millions and millions of influenza vaccinations that have been given out over the years. We know that this vaccine is safe. We know that it may not prevent you from getting influenza in each case, but you know what? It prevents you from becoming hospitalized. And obviously, we want to protect ourselves from dying from a flu related illness, because it's a preventable disease. So just think of it that way. And I think it's important for people to know that the side effects that you can have some soreness in the arm. Maybe you might feel a little warmth when you feel over the area that you did receive the injection. But we know that those side effects are very, very mild. So I want people to hear that. The flu vaccination is safe, and the effects that you will have from it, the side effects, are very, very small, and they won't stop you from going to work or carrying on your daily activities.
I think that is extremely, extremely important to understand. You're not going to get the flu. They're not giving you the flu when you get the vaccine. I think that's a misconception. Because I would say, full disclosure, I had that misconception for a while. Like, oh, but they give you a little bit of the flu and then your body fights it, and then that's how you become vaccinated. No, that's not the way it works. I had to talk to some people that do better than me that said, no, that's not the way it works. They're not giving you the flu. So let's dispel that myth right now. You're not getting the flu. What you are doing is you're preparing your body. It's like building an army before you go to war, right? If you don't have an army and war starts, you're going to have a hard time fighting it, right? But if you have an army, if you do contract influenza, you're better prepared to deal with it. It lowers the risk of hospitalization, and it really lowers the risk of death. So it doesn't stop you from getting influenza, but it does lower that risk of hospitalization and death. And so why wouldn't you want to be prepared just in case that does come to pass?
Absolutely. Yeah, I think people should know, if they don't know already, that the flu vaccine actually contains what we call killed influenza virus. It is not a live virus.
Right.
So it's not going to give you the flu. It's killed. It's a killed virus. It's inactive. But it's there enough that your body will react and make antibodies against the influenza virus. So when you're exposed to it, hopefully it'll protect you from getting the flu. But it is a killed, inactivated virus. You're not getting live virus. So I'm glad you brought that up, Ellis, because I want to clear that up also.
Please, yeah, we're here. We're dispelling myths. And if you're just joining us, we're talking to Dr. Patricia Whitley-Williams. She is the immediate past president of the National Foundation for Infectious Diseases. So they're the people that monitor the COVIDs and the flu and all that other stuff. Like all those infectious diseases that are out there, there's a whole foundation that is dedicated to making sure and monitoring, and that not only they're monitoring if any new infectious diseases are coming out, and they're also monitoring the ones that are out there and making sure they're keeping the population safe. So I'm gonna trust Dr. Whitley-Williams on this one. I'm gonna trust. I'm just saying, my man in the barbershop. It's cool. I got you, but it's still cool. But I'm gonna trust Dr. Whitley-Williams on this one. Just say it. I do.
Good. Thank you.
Okay.
Thank you.
So, all right. So we're talking to. How do we talk to family members? Like, how do we get that? So, like, I've gotten mine, but now I've got to go. Okay, I've gotten mine. I can share my experience. How do we talk to family members? How do we convince friends and family to say, you know what, it's not that bad. Let's go ahead and get it so we can protect, so we can feel more comfortable being around each other. We know COVID is still out there swirling around. Why can't we just go ahead and protect ourselves from as many infectious diseases as possible? So when we all gather and come together, we feel more comfortable. How do we approach that conversation with our family?
Right. I think it's so important to have this conversation. And usually, family listens to family. Not always, but not always. But but when it comes to this, if someone steps out and says, you know what, I received my flu vaccination. It wasn't that bad. And you know what? I'm so glad I'm protected now. And I want all of you to get your flu vaccination. In fact, I got it here. You just go there and tell them that's what you're there for. Tell them how easy it is to get it. And it, of course, any injection might hurt at the time a little bit, but right after, like I said, it usually doesn't bother you. Everybody reacts to pain in different ways, but this is, in fact, you know what? I got the COVID vaccine booster in one arm, and I got influenza vaccination in the other arm. And I can tell you, I didn't even notice the flu vaccine. The COVID vaccination was a little bit sore for a couple of days, but I
Yes.
did not notice the influenza vaccination at all. And I certainly thought twice about it. I said, do you really want to get an injection in each arm? But you know what? I knew that I had received um, so many annual influenza vaccinations. So I knew that that was not going to hurt me. And it's not a contraindication. You can receive the COVID
Right.
19 and the influenza vaccination at the same time. Just, of course, you're going to use different arms, but it was not a
Right.
problem at all. So, again, you can share that with family. And then talk about the importance of family. You want to, when those holidays come around and those
Hmm.
celebrations come around, you want to be able to be with your family. So,
Right.
again, receiving the vaccination actually reduces your risk of getting it. Unfortunately, it doesn't 100% protect you from getting the flu, but you know what? You'll be more or less likely to get the flu. And then you can join your family celebrations. And you don't want to expose your mom or your mother or your grandmother or particularly
Yeah.
elderly people who may have some of the comorbid conditions. And they may be frail. You don't want to expose them to the flu. So protect yourself, but also you're doing it for your family and those people you love.
I couldn't agree with you more. And I promise you, I'm telling you, personal experience. And I was because I'm shot phobic, right? I am vaccine phobic. I don't like to get blood
Mhm.
drawn. Whenever I go to see my doctor, I have to do the head turn, and they just say I tell them which arm, and I turn my head, and I'm like, just do it. Don't give me no countdown. Don't do anything like this. Just do it. And this was by far the easiest one that I've
Mhm.
I've
Absolutely.
I got the shingles vaccine. That one
Good
was
for
painful.
you.
That was painful. And the COVID, both of those vaccines, the arm was sore for a couple of days with both the
Yes.
shingles
Yes.
and COVID,
Yes.
but with the flu, I
Yes.
literally forgot later on that day. And when I went to go take a shower, I still had the band aid, on my arm because
You
I
didn't
had no
even notice.
didn't
Hmm.
even know. So just go get the bag. It's not that bad. I promise you. I promise you that.
Exactly.
So we've mentioned the National Foundation for Infectious Diseases. What are they doing to kind of combat some of the disparities that you mentioned earlier in the broadcast? What are some of those? What's the NFID doing to combat those disparities?
Yeah, I'm glad you asked. This is a wonderful organization. In fact, let me, as I'm answering your question, just let the listeners know that the participants know that you can go to the NFID website. It's a wonderful resource for information about infectious diseases, not just influenza and influenza vaccinations. So I certainly want to encourage our listeners to do that. But NFID is an organization that prides itself in educating the public and healthcare professionals and communities about infectious diseases. And one of the things that we really are focusing on, and that is working with Black led organizations and communities of color to really increase the vaccination rates of vaccine preventable diseases. And what do I mean by that? I mean, how many of you have maybe seen a case of tetanus or smallpox or diphtheria? Probably not. Not certainly not in the US. And the reason for that is that we have vaccinations. Now, I have a colleague who says, you know, it's not any good to have vaccines made and they're sitting on the shelf because what prevents illness and disease and death is actually putting that vaccination in the arm, putting that vaccine in the arm. So it's really important for people to understand that. And NFID is really trying to work together and collaborate with Black led organizations to try and reduce the deaths and hospitalizations, for instance, from influenza, because we know that there are disparities there. Also, trying to get the message out that our immunization rates, in other words, we have far fewer people in our Black community who actually go and get vaccinated, and not just for influenza, but for some of the other vaccine preventable diseases, but particularly for flu, because we know that flu vaccination will reduce your risk of getting hospitalized and even dying from influenza. So I'm proud to be a member of the National Foundation for Infectious Diseases, and we really have taken this on as a goal-driven mission that we will make an impact. And we really want to get the word out so that people are not afraid to go out and get immunized. We deserve to have a healthy community and a healthier community. And we need to reduce these health disparity gaps in terms of Black and Brown people being more at risk of being hospitalized from influenza. And I believe we can do it, certainly in partnership.
Absolutely. I could not agree with you more on that. And I would just say, particularly if we want to protect our community, we can't complain without taking action, right? You know,
Mhm.
as they say in church, faith without work is dead, right? And so we say
Right.
we've got to put in the work, and the work
That's
is
right.
doing what we can do to protect our community. And one of the things we can do is by going and get vaccinated, particularly about something like the flu. We have
Excellent.
really good teams putting together and studying and making sure that the vaccines are safe and effective each and every year. So trust their work, trust what they're doing, and go get vaccinated. It's not that hard. Um,
Absolutely. No, I'm glad you asked me about NFID. It's terrific. And again, visit that website because you will learn a lot of great information.
Absolutely. I'll put that on screen here for
Thank you
so
so
people
much.
know.
There you go.
Yeah,
Right,
yes,
/ flu. That'll take you right to that important information that we're discussing today.
absolutely. So go to that site, get the information that you need for you and your family, and get all the information. So we're going to tell you our personal experience, as Dr. Whitley-Williams talked about her personal experience. I'm talking about my personal experience, and trying to give you that kind of word of mouth, co-signing, for lack of a better term, for what it is. But still, if you need more information to make an informed decision for you and your family, this website is a great resource for you. We know the internet is full of a lot of information. It's got a
Mhm.
lot of information. Please let's go to the sources that are factual actual incredible, instead of those blog sites and those sites that
Right.
don't have to research to support what they're doing. But this is a great site to go to get the answers to the questions that you might have about this vaccine or any other vaccines that the NFID is working on. All
Absolutely.
right. So we talked about how we talk to family members. All right. So they say, you know what? I'm still not listening to you. I don't care what you're talking about. So how do you stop them from coming to family functions? Right. So, okay, cool. You don't have to get vaccinated, but you can't come to the cookout. You know, it's like, because you can't come to the cookout if you're not vaccinated. How do we have that conversation with that stubborn family member?
Yeah, well, certainly if they have any symptoms of the flu, right? Any fever or cough or aching or sneezing and runny nose and congestion, they can't come. But
Right.
what we would say is, again, you don't want to bring that to the family reunion, the family barbecue, because guess what? You're going to be spreading that infection, the flu, to
Right.
everybody else.
Right.
And that's not very good, right? Again, you want to protect. Certainly, I'm sure you don't want to do that, and particularly if there are people there who would end up in the hospital
Right.
because they were exposed to you. So I think it's an important conversation to have. And what you could say is, you know what, we'll make a nice little plate for you. We'll put some, we'll put some,
You can
barbecue
have it up
chicken,
aluminum foil. We'll put
right,
some
some
aluminum foil on it.
barbecue shrimp or whatever, and a little salad on the side, little potatoes. And we'll be happy to bring it to you. But you know what? You really need to get vaccinated, and that way we won't have this discussion. Now, again, if you're having symptoms, it may not be the flu. You might not know. So, as a general rule, just like we did with COVID, right? You should really stay isolated, not spread it to other people. But
Right.
I think that conversation with a loved one would be, we'll bring you a plate. And you know what? Maybe next year you can come because I'm sure you're going to be getting your annual flu vaccination.
Absolutely. We got to get it. Uh, we got to get it annually, right? So that's something that has to happen. And I'll again speak from personal experience. My family got together over the holidays,
Mhm.
and I just realized it was a tough conversation because you might be talking to an older member. You might be talking to your aunt. You might be talking to your mother. You might be
Yes.
talking to your grandmother. That's a tough conversation.
Yes.
I went through it, but once I started having those conversations, so much more information came out, and
Mhm.
everybody felt comfortable in talking about it. You
Exactly.
just have to broach that conversation and have that first question. Hey, have you got any flu vaccine? And that's all you have to do, and just step back and then
Mhm.
let them. And then you can
Mhm.
say, here's what I've learned. And then you can share that website that we put in. I'll put it up again on the screen, and I'll also drop it in the comment section for you so
Mhm.
you can click on it. Um, but just once you open that conversation up, everything flows so much easier with it. So,
Absolutely. The other person you can refer that person to is their primary care physician,
yes,
because they also can have a conversation with them. And we know from surveys and research that most patients trust their physicians and what they say, is, especially their primary care, their personal physician. They do trust what that physician says, particularly regarding vaccinations. So, again, family members, yes, definitely a go to really try to understand and feel more comfortable and trusting in order to go and get a vaccination. But certainly, I encourage you to speak to your physician. And particularly in the Black community, but any patient really does trust their physician when they're educating them and talking to them, encouraging them to go get a flu shot, flu vaccination.
if I could add one more source that they could go and talk to is your
Sure.
local pharmacist, right? So
Oh,
your pharmacist at
absolutely.
which pharmacy you go to, Walgreens, CVS. There's a number of them out there, but your pharmacy is more than likely closer to where you live than maybe a urgent care center or a medical facility. So,
Absolutely.
and they're open later. So if you can't say, well, in my doctor's office, I'm had to work, I couldn't go see my doctor. All right, well,
Absolutely.
go talk to your pharmacist. They've got that little room. This
That's
does a
right.
consultation,
That's
right?
right.
That's what that room is for, right? To have that.
Absolutely. I went online and scheduled my flu vaccination because it was easier for me to do it in the evening. Now, sometimes, obviously, the hospitals will immunize their own employees, but for whatever reason, I missed it, and I went online and scheduled an appointment to get my flu and my COVID-19, and it was very convenient.
Yeah.
So I also use the pharmacy, but they are wonderful collaborators and our colleagues in trying to reduce the number of vaccine preventable diseases like influenza. Our pharmacists are wonderful, they're wonderful educators, and they also vaccinate. So they are part of our armamentarium in terms of really trying to protect the public. And they're great educators. As you
Yes.
know, if you go pick up a prescription, you're not sure, they will have a conversation with you about your medication. Well, they're also educated about
Yeah.
vaccinations as well.
Yeah, they're fantastic. So it's kind of like that protection triangle, right? So you want to get that information. One,
Mm.
you can go to the NFID site and get more information /flu. You can talk to your primary care physician about getting vaccinated, and then you can also talk to your local pharmacist right there in the store after hours, Saturday, Sunday. They're open seven
There
days
you
a
go.
week.
That's right.
They're open 7 days a week, and so there's somebody there behind that counter. So there's no excuses. We're eliminating all the excuses. We're checking them off one at a
Absolutely.
time
Checking
today.
all the boxes.
Checking all the boxes. So there's no excuses to go and at least information excuses, right? And then you could still say, okay, look, it's a personal decision, but at this point, we're going to try to answer as many questions as possible.
Yes.
So we talked about the primary care physician. That's somebody you should be listening to because they know you and they're working with you on your health decision. If you don't have one, try to establish one. Urgent care is great, but it's
Mm.
it's designed for a specific purpose, and that's something that's urgent that's come up.
Mm.
You should have a relationship with a primary care physician. But I know people of color, communities of color, tend to look within. We tend to go talk to our friends, we talk to other folks. So, who do you think that Black people are more likely to listen to when it comes to a vaccine recommendation? Is it a friend or family member, or is it that primary care physician combination? Who are we more likely to listen to?
So oftentimes it's the mother that they will
Yeah,
listen to.
that's
Um,
fantastic.
and go to mom for advice. And then the second thing, of course, is their physician, particularly Black physicians.
Yeah,
I do belong to the National Medical Association, which is a
right.
national organization of mostly African American physicians. And we talk about this all the time. We're trying to improve the health status of our community because a healthy community does better, obviously, socially, financially, as well
Right,
as medically, right?
right.
So we try to really emphasize this, but most people will listen to their mother. And then, of course, they will listen to their physician, particularly in the Black community. And many of us and many of our Black physician colleagues actually led or continue to lead vaccination drives within their own community, whether they do it along with their church or organizations, community-based organizations. They really are committed to trying to reduce this gap. And we know there are barriers. We know there are structural barriers. You just mentioned one in terms of, if people are working and they can't get to their physician during the day, or they can't get to a particular place during the day to get a vaccination. And so that's why it's so important. I'm glad you brought that up about the pharmacies and particularly retail pharmacies in these stores that stay open late. So yeah, again, it's we're all in this together, and I think that's what's so important, and that's the message I want to get across. Get your annual vaccination, learn the facts, discuss any myths or misbeliefs or fears or mistrusts that
Right.
you have, so we can really try to reduce these gaps.
I couldn't say it even better. And I love the fact that you mentioned, that faith community, because we know
Yes.
in our community that faith plays an important role for many people, and they kind of lean on that in terms of, okay, do I trust it? How do I trust it? If my faith community is in support of it, they might be more likely to engage, and so that's an extension. So if
Mhm.
mom's not around anymore for whatever reason, or if you're not having those conversations, you can
Mhm.
also lean into your faith community, and many clergy have really come on. We've had
Yes,
a
we
number of
have.
Al Sharpton to TD Jakes
Mhm.
to Deborah Fraser Howell, all a lot of really prominent people from the faith community come
Mhm.
on and talk about the importance of getting vaccinated, because they understand that you can't have a healthy church without healthy people in the church.
Absolutely.
And so
Right.
it goes hand in hand.
It does. And sometimes you'll hear, well, God will take care of me. Well, if you break your leg, God doesn't say, okay, I'll take care of you. God says, go get your leg set and get a cast and get some
Right?
physical therapy after so you can heal 100%. So,
Right.
again, just having these discussions so that people realize this is just common sense.
Absolutely. So I think, one thing I want to do is kind of a recap on really what we are, some key takeaways for people to kind of talk about uh, when they're leaving. So if you're watching this, and we're here with Dr. Patricia Whitley-Williams, immediate past president of the National Foundation for Infectious Diseases, and we're talking about flu. We're still in flu season, for the record, right? I know
Absolutely. We
it's,
are.
and we're still in the middle of flu season.
We
Uh,
are.
we talked about earlier in this conversation, it's been particularly bad this year, and I think it's because, like, remember during COVID, everybody was wearing masks, so the spread was down. And now that most states have taken masks off, we see people walking around without masks on all the time. The flu has come back with a vengeance, right? Like the return of the flu,
Absolutely.
like
Yeah.
a bad movie, the return of the flu, right? So, um,
Exactly. Great movie title, right? So,
yes,
so, right. So, one of the take home messages certainly is everyone who is 6 months and older, 6 months of age and older, should receive an annual influenza vaccination without question. So, if you don't take anything else away, please take that away. And then, secondly, is we want you to make sure that you're protecting not only yourself, but the people around you, your loved ones. And that extends into the community. If we all do that, we become a healthier community. So remember, you cannot be there for others if you don't show up for yourself first.
right.
And that's what we're talking about. Put that oxygen mask on first, because if you stay healthy, then you're able to pass that message along and serve as an example for people who love you in return. But then your whole family stays healthy.
So, and I think, as a pediatrician, there are some ways. Is there a other way other than the injection to give it to children? I just want to give potential parents that are watching the program, some options just in case their child might be a little bit really squeamish about getting an injection.
Sure,
Is
sure.
there another way?
Yes, so there is a spray mist that is a vaccine, a flu vaccine. Um, However, your doctor will speak with you, because if your child has asthma, then
Okay.
when they're younger, they would prefer not to use that method of vaccinating. They would rather your child receive the injectable vaccination. But
Right.
yes, there is an alternative, and they just spray it in the nose, and it um, makes the body produce protection in a similar way. So I'm glad you brought that up, because that is an alternative.
And that's for children up to age 5, 6. What?
Yes, up to
Okay,
age 5. Yeah.
up to
Mhm.
age 5. So 6 months to 5.
They can get the spray.
The mist is available, but again, check with your doctor. Make sure your child does not have asthma or any other kind of respiratory illness that could cause some complications. But if they're
Correct.
safe, they can get that. And then after the age of 5, then everybody gets that injectable. And like we said earlier, it's real easy, y'all. Children
Exactly.
And yeah, we're talking to a pediatrician. How many vaccines do children get in their first stages of life? What, 16? I think the last.
Well, the wonderful thing about vaccines is that they prevent infections that, guess what, we no longer see, at least in
Right,
this country. We no longer see smallpox. We don't see diphtheria. We don't see a lot of tetanus, except maybe near the border, in people who have
right,
not been vaccinated.
right.
Polio,
Yeah,
right? We don't see polio. Uh, and whooping cough, we may see some again, but it's because usually the adults are not vaccinated
right,
or they don't get a booster.
right.
So I think those are some of the things. You know what else? Something else I should have brought up, and that is pregnant women.
Okay,
People think
great.
pregnant women can't be vaccinated, but
Mm,
pregnant women, because of the pressures that pregnancy puts on the body, they actually have a harder time dealing with infections during pregnancy, and particularly viral infections like influenza, like COVID, like
mm,
chickenpox, varicella. So, if a
yeah,
pregnant woman becomes infected with these viruses, just to name a few, they can become deathly ill. And then, of course, they are carrying an infant, a fetus, and that fetus can also be affected. So we really encourage, because remember, I said it's a killed vaccine. So we
right.
recommend that pregnant women be vaccinated against influenza. And you know what else we found? When those pregnant women are immunized, guess what? Their newborns for the first couple of months of life are less likely to get influenza if they're exposed to it in the household. Because remember,
Right,
those babies can't be vaccinated until they're 6 months of age. So by the
right.
mother getting vaccinated, the flu vaccine, it actually protects the infant, her newborn. Isn't that great? Isn't that a wonderful
That is
thing about
fantastic.
vaccines?
That is fantastic. Because
Isn't that
remember, as
amazing?
mother, everything passes from the mother to child, and so if mom gets vaccinated, that child gets some protection up until they
Absolutely.
get their vaccine at 6 months. And so that is fantastic. Particularly, we know how vulnerable infants are when they're first born, and so to have any type of protection is great. We just did a program on CMV, and I don't know if y'all know
Oh,
about
yes.
CMV. You know about
Yes.
it.
Oh,
I
yes.
know about it. But I just learned about CMV last week, and I'm like, and that's and congenital CMV. If you're a mother of birthing age, you might want to learn about congenital CMV. It's not nice. It's not nice if you contract, and that's another virus that's out there.
Exactly.
And so you don't want to be exposed. We're trying to protect the body. The body does a good job of protecting itself, but there are some ways that we have developed that can help the body, boost that body, give you that defenses ahead of time. And that's what vaccines are designed to do. Give you that army to fight these viruses that are out in our environment, that are in our atmosphere, that could be really doing damage to us. And so we just got to trust that.
Absolutely.
No.
Absolutely. CMV is the most common cause of hearing loss in children.
Yes.
Yeah.
Yes. And I
So,
just
but
used it.
again, we don't have a vaccine for
Right.
cytomegalovirus, for CMV, but we
Right.
do for influenza. All right?
Y'all hear that?
Yes.
Yes, I like y'all hear that? There is one for the flu. So just finally, as we're wrapping up, I'm asking if anybody has any questions. We'd love to have your questions. There were a few that we kind of worked into our discussion, but I just want to open it up as we're wrapping up here with Dr. Whitley-Williams. Are there any questions? We will make sure that no stone is left unturned, no question is left unasked. We've talked about pregnancy, we've talked about infants and children, we've talked about who you could be talking to. We've given you some references. You could talk to your pharmacist. You can go to the insight that I've already put in the comment that you can click on it and get that wonderful information. We talked about what you should be doing, taking care of yourself first, right? Putting that airborne mask on first before you reach to help your
That's
neighbor.
right.
So help yourself first, getting yourself cleared. So if there are any other questions that we have, and I just want to really kind of emphasize this final point. Um, and we've been saying it throughout, but I really want to put this on the screen if I can get it to come up. Come on, work with me. There we go. Flu vaccines are safe, right? I,
Absolutely.
I am not worried. I am, those that seen me here before, I'm fully transparent. I got my first flu vaccine this year, and
That is terrific.
it was really no problem. And I will go get one at the beginning. I got it in January, but I would go get it at the beginning of the flu season in 2023, and I will continue to get the flu
Good.
vaccine going forward. And so I'm speaking, and that's no lie. That is honest to God's truth, because we try to give we're as transparent and as authentic as possible here on blackdoctor.org. So
One of the
just
questions that comes up is it too late to get a flu vaccine? Since I
right,
mentioned, we had our peak, but there's still influenza. I'm on call today. I'm going to have to go over into the hospital after this. And I can
right,
tell you there are patients on the floor with influenza.
yeah,
So the answer to that is it is never too late to get your annual influenza vaccine. If you have not received a flu vaccination this year, please make plans to go and get your flu vaccination. It is not too late. Usually we say, past maybe April or May, but you know what? The way these viruses are emerging and circling, we're
right,
not sure when the peak is going to come, just like it came earlier this year. Usually flu vaccine is available at the end of August, early September. That's
mhm,
really when we want you to get vaccinated, to get protected.
right.
So I can't say that enough. It is not too late to get one if you've not been vaccinated this year against the flu.
Right.
Please go get your flu vaccine.
And like we said, most pharmacies will take you even as a walk-in. If they've got it in
That's
supply,
true.
they will take you as a walk-in, but they all have apps that you can just download and schedule an appointment.
Mhm.
Or if your primary care physician is backed up, you don't have to wait to go see
Absolutely.
your primary doctor. You can go see your pharmacist and get vaccinated. That's what I did. I was like, hey, doctor's appointment's
Absolutely.
going to be weeks out. Pharmacy appointments tomorrow. So I went I went and got it, and no problem. And I asked pharmacist questions, and she answered all the questions that I had, and it was a very easy experience. I
Wonderful.
could not speak more highly about it, which is why I was excited to do this program. And it was interesting to do this program, but I was like, you know what?
Mhm.
I had just got the vaccine, and I am good to go. So I want to be able to share that personal experience as part of this program. So.
Wonderful.
Um,
What made you change your mind? I know you're supposed to be asking the questions, but I'm just curious. What made you go and get your flu vaccine for the first time this year? I think it's wonderful.
it was a couple of things. One, COVID kind of really shook me up, right?
Mm.
I had some family members get contract COVID. Thankfully, they did not pass as a result.
Oh, thank God.
But as they talked about that experience, and I was like, wow, we have vaccines
Mm.
available. You know,
Absolutely.
why shouldn't we take advantage of
Mm.
the ways we can protect ourselves? And yes, I'm all
Mm.
about eating healthy and exercising. I do understand that
Mm.
vitamin D3 is important in terms of your immune system and all the things
Mm.
that we can do to boost our immune system naturally. Um,
Absolutely.
but there is something that if there's something that's available for you, let's take advantage of all of those things to keep ourselves healthy. And
Mhm.
and I realize that I'm getting older. I've got aging
Mhm.
parents, and I'm watching them go through some health concerns, and I'm like,
Yes.
what can I be doing to protect them when I go visit them?
Absolutely.
And that was
Absolutely.
another issue. So I was like, my father has been, in and out of the hospital, and maybe I'm sharing too much, but
Sorry
when
to
I go
hear that.
see, when I go see him, I'm like, I need to do anything to protect him. And so the way
Absolutely.
I can protect him is by protecting me. And if I
Absolutely.
protect myself, then I have a better chance of protecting him uh, in his state. So really, just that's
That's
what
great.
started, and now like I found out how easy it was. I'd always had these misconceptions.
Yes.
And I'm like,
Yes. Yeah.
September, I'm gonna put it on my calendar. Just say when the new flu
Wonderful.
pops out, go get it. No
Well,
problem.
thank you for sharing that. And the message is, I think you've just said it. You wanted to protect yourself and protect those around you, the people you love.
Yeah. So I just thank you. I do have an exit poll for those folks that have been staying with us. Uh, did this discussion positively impact your thoughts around the flu vaccine and the need to get vaccinated every year? So drop that in the comments. If you've been watching us throughout this program, talking about the different methodologies, talking about the disparities that are impacting our community in terms of the flu and prevalence, and as well as the kind of more negative impact of catching the flu. So really, uh, hopefully we've had an impact, but that's what this
I
poll
hope
is.
so.
So please drop this. Please drop your answer. Be honest. If it didn't, just say that. No, it didn't. And it's stuck in your ways. That's cool too. But we just want to know. So please drop that in as we're wrapping up here. It's been a joy talking to you, Dr. Whitley-Williams. This is going to
Same
be easy.
here.
I like easy conversations. I don't want to make it hard. Like and getting vaccinated shouldn't be that hard either. It should be an easy conversation that we're having as a community. And so hopefully we've provided some great information for our audience that are watching us. Again, as I said at the top of the program, like and share this program. Get this information out. We're still in flu season, and as Dr. Williams said, we don't know how long it's going to last.
Mm-hmm. Absolutely.
So
protect yourself.
Mm-hmm. Protect yourself. Exactly. Show up, fight the flu, do what you need to do. Stay safe. Hashtag show up and fight flu. Put that on your page. People are like, what you're talking about? Ask me about the flu. Right?
There you go. We have hashtag families fighting flu. Hashtag fight flu. Absolutely. Hashtag show up and hashtag fight flu. We're all in this together. We really need to help each other, and we can make a difference. We can reduce those disparity gaps. So let's all do our part, right? I in my small corner and you in yours. Every light must shine.
Well, we're gonna invite you back in September. We'll do this again. We'll do this again.
Oh, wonderful! I'd love to come back. This has been fun.
Great.
I always love to talk about vaccine preventable diseases and making sure people have the information so they go out and protect themselves.
Absolutely. So again, this has been a joy. Thank you so much. Thank you everybody for staying with us here on a Friday afternoon, morning. Go out. You still got the weekend.
There you go.
Go get that vaccine. Go get it, and then you'll feel, I promise you, the peace of mind that comes with it is well worth it. So go get vaccinated, and then we'll talk to you in September when it's time to run it back.
Sounds good. Thank you for having me.